Bismillahirrahmanirrahim. Rabbi zidni ilma. You can never cross the ocean until you have the courage to lose sight of the shore. Assalamu alaikum. My name is Dr. Sadia Rafiq, and under the supervision of Professor Sara Afzal, today my topic of presentation is family planning, including intrauterine contraceptive devices, injectables, and permanent methods. Learning outlines include the introduction of different methods of contraception, including IUCDs, injectables, permanent methods, recent advantages, and multiple choice questions. Learning outcome. At the end of this presentation, my colleagues will be able to describe different methods of contraception, their usage, advantages, and disadvantages. Contraception means against conception. The preventive methods to help women avoid unwanted pregnancies are called contraceptive methods. Need for contraception to avoid unwanted pregnancies, to regulate the timings of pregnancies, and to regulate the interval between pregnancy. Ideal contraceptive is that which is safe, effective, acceptable, reversible, inexpensive, long-lasting, and requires little or no medical supervision. Methods of the contraceptions are temporary and permanent. Temporary methods are used to postpone pregnancy or space births, including barrier methods, natural contraception, oral contraceptive pills, injectables, implants, and devices, IUCDs, and the permanent methods aim is to purposefully and permanently destroy the reproductive capacity of an individual. In females, it is called tubectomy, and in males, it's called vasectomy. Comparing typical effectiveness of contraceptive methods. It is recommended by WHO, and it has 3 tiers, tier 1, 2, and 3, and from less effective to more effective. The devices, the methods which are included in most effective tiers, just those implants, vasectomy, tubal occlusion, and IUDs. And there's pregnancy less than 1 in 100 women in 1 year. Tier 2, there are 4 to 7 pregnancies, includes injectables, pills, patch, and rings, and in the least effective is more than 13 pregnancies in 100 women per year, includes the condoms, and all the other remaining procedures or methods are included in this. So the most effective is this one, tier 1, in which these procedures are included. Starting with intrauterine device. The uterus is a pear-shaped dynamic muscular organ that is responsible for a variety of functions such as gestation, menstruation, labor, and delivery. The uterine drug delivery systems work with a variety of medical or non-medical devices that perform the act of contraception in the uterus continuously for a prolonged range of time. In recent time, they are mainly used for family planning. The device which is used in the intrauterine drug delivery system is known as intrauterine device. IUDs or intrauterine devices are small artificial objects or devices inserted into the uterus to prevent the occurrence of pregnancy by disrupting the fertilization process as a result of sexual intercourse. They have gained a popularity in recent times and one of the most effective methods of birth control in terms of long-term contraception. It can be easily installed and is flexible. These devices are usually small in size and inserted through the cervix. IUDs reduce the need for abortion with unwanted pregnancies by preventing the effective movement of eggs and sperms. However, it cannot confirm the spread of STIs or STDs such as HIV or gonorrhea, etc. So, as you can say, this is uterus, this is cervix, and this is vagina. So this is IUD T-shaped, and it is a string. So it is implanted in the uterus like this. And the uterus IUD string hangs out, which shows that the position of the IUD is correct. Another picture. So what are the advantages? Low probability of death in this compared to the oral pills, doesn't alter or affect the natural hormonal balance, offer long-term birth control around 2 to 10 years, doesn't interfere with sexual activity or coitus or libido, high patient's compliance in terms of dosing frequency and adherence, can be used by nulliparous women, Actions can last for a longer time if not removal in between, does not interact with body organs, can be easily fitted and removed. Better alternative contraceptive if the patient can't take pills or has a weak memory. Immediate onset of action is seen. IUDs can be used by breastfeeding or lactating women, can be used by women of different multiple therapies like diabetes and cancer, except hormonal contraception. Reversible as fertility returns after discontinuation, IUDs can be used by women at any age, effective and simple to use, cost effective, no ongoing cost after initial insertion, and long-term effect, preferably up to 12 years in case of copper IUDs. Disadvantages. Higher rate of birth compared to oral pills. Insertion requires a qualified medical practitioner. Can't prevent risk of sexually transmitted infections, menorrhagia, dysmenorrhea, polymenorrhea, major reasons for IUD discontinuation. May increase the likelihood of ectopic pregnancy, higher risk of uterine infection or perforation if not inserted properly, increased chance of pregnancy if not administered properly. Insertion can be painful or can worsen menstrual cramps at times. Copper IUDs should be avoided in case of Wilson's disease. Hormonal IUDs not recommended for liver disease or breast cancer. Risk of expulsion within the first year. Irregular bleeding in initial stages. Can't be used in case of pelvic infection or heavy bleeding or endometriosis. Side effects include nausea, vomiting, headache, or weight gain. Can cause unwanted allergies. Risk for preterm delivery if you get pregnant with an IUD, particularly if it's left in place. Development of IUDs. Medicated IUDs, there are two classes of medicated IUDs are available. Number one is non-hormonal IUDs or copper medicated IUDs, and second is hormonal or progesterone containing IUDs. So intrauterine devices are first generation, second generation, third generation. First generations are inert non-medical devices. For example, Lippis loop, left as long as required. Second generations, metallic IUDs, copper IUDs, which are placed for 10 years, Nova T, 5 years, and multi-load devices. And third generation is hormonal IUDs, progestastat for 2 years, and Mirena, levonorgestrel for 22, LNG20 for 10 years. So copper medicated IUDs, these are different types. I'm just not going to the complete explanation of all IUDs, just mentioning the name. These are all copper medicated, copper 380, argon, copper T380, copper 200, multi-load 375. It has 2 arms and 1 shaft. This is for the arms are for the holding of the, it is of make of plastic. It just fixes itself in the body of the uterus, and it is a shaft with the copper installed in it. Next, the one is Nova T and the copper T IUDs, different shapes and forms. That comes a hormonal IUDs. These can be further characterized into progesterone-containing IUDs or levonorgestrel releasing IUDs. Hormonal IUDs work by releasing a small amount of hormone, either progesterone or levonorgestrel. The primary mechanism of action is making the inside of the uterus fatal to sperm. They cause thinning of the endometrial lining and potentially impair implantation. Doyer and Clay were the first to initiate the use of hormone-releasing IUDs in the year 1970. Scomagna conducted a human test using a standard IUD containing contraceptive steroid. Then come the progesterone-releasing IUDs. These IUDs make the cervical mucus thick so that sperm cannot enter the uterus. There is a change in the lining of the uterus to enhance uterine retention, which does not allow pregnancy by slowing releasing steroids. Suppression of ovulation is seen, and also it prevents the survival of sperm. It prevents pregnancy for about 5 years by releasing a small amount of progesterone evenly into the uterus. Hormonal IUDs are similar to copper Ts. These devices are T-shaped devices made up of polyethylene frames measuring 32 millimeters in horizontal and vertical directions. So you can see in this picture, this is the IUDC is placed in the uterus. Then come the levonorgestrel releasing IUDs. These contain levonorgestrel releasing device. It is an intrauterine system with sleeves containing levonorgestrel 52 milligram around its base. It contains a polyethylene stem coated with the metric celestine. Withdrawal of 20 micrograms per day and duration of at least 5 years. Immediate release, and then a dose of 60% drug reduced to 16 micrograms per day. It also suppresses endometrium and ovulation. Also, unlike other IUD, it can reduce the risk of PID. It is very important in case of the levonorgestrel releasing IUDs. We can use them in case of PIDs if it is required. Just mentioning you the different names of the levonorgestrel releasing. These are the Mirena iLilita. It is same T-shaped polyethylene radiopaque frame measuring 32 mm to 32 mm. A Hormone cylinder is made of combination of 52 milligram levonorgestrone and silicone, which regulates membrane drug release. It is released in the first at the rate of 20 microgram per day for 5 years. Examples are Mirena, iLilita, Levocet. These are the names of the devices which are available in the market. The Mirena is approved in the US for 5 years for use of contraception and the treatment of heavy menstrual bleeding. In more than 100 countries, this IUD is also approved as a source of progesterone to prevent endometrial proliferation with the use of postmenopausal estrogen therapy. The applicator used to place in IUS utilizes a straightforward single-handed placement procedure. The cost of this IUD generally tends to be higher than the newer version. The other same mechanism of action, I'm just mentioning them because they are with different names in the market, which is known as Skyla, Jedis, Latte, and Levocet. These are all levonorgestrel releasing IUDs. Some have the duration of 5 years and some have the duration of 7 years. So these are different shapes like Mirena, arms and shaft, Kylina, then it's a copper T, it's a copper plant, and this copper load. Its shape, you can say it's different like this, and it is copper over here. Disadvantages. It can cause non-cancerous or benign growth called ovarian cysts. It can cause hormonal side effects such as chest tightness, breast tenderness, mood swings, headaches, nausea, acne, etc. When side effects occur, they usually subside after the first few months. The contraindications include ectopic pregnancy, puerperal sepsis or miscarriage, stillbirth, unexplained bleeding of the vagina, genital injury, tuberculosis, pelvic inflammatory diseases. So again, these are the some side effects of the Kylina IUDs, vulvovaginitis, acne or greasy skin, headaches or migraines, ovarian cyst, then stomach or pelvic pains, breast pain or discomfort, increased bleeding and dysmenorrhea and uterine spasm. Non-medicated IUDs. IUDs contain a bioactive component which is made of non-abrasive materials such as stainless steel or plastic. The stainless steel ring is flexible ring that is to be inserted through the cervix. The plastic like lip is loose, which can be inserted into the cervix into a cannula, takes a trapezoidal shape into the uterus. It is less effective than a copper or hormonal IUDs. They use their contraceptive action by producing a sterile inflammatory response in the endometrium by its mechanical interaction. The mechanism involving a local body reaction that causes the uterus to become hostile to both sperm and prevents the implantation of the embryo. These IUDs have a higher rate of contraception after a pregnancy compared to a copper or hormonal IUDs. This is the comparison of different names: Paragard, Mirena, iLilita, Kylina, and Skyla. In this, the hormone Paragard, it uses copper. Dose is not available. It is approved for 10 to 12 years. Like Mirena, 20 microgram per day, 52 milligram total in the device for 5 to 7 years. Then iLilita, again, 18.6 micrograms per day, and his total is 52 milligram, and it is for 3 to 5 years. Then Kylina, dose is really 17.5 micrograms per day, and total is 19.5, and it is also for 5 years. Then Skyla, 14 micrograms per day, 13.5 is the total, and it is for 3 years. These are all levonorgestrel releasing devices. Then the key difference between different IUDs like Paragard, Mirena, and Skyla. This is copper. These are both hormones. It lasts for 12 years, that is 5 or 3 years. And your periods might have, in this case, 0.8% is the failure rate, and the copper, the periods might get heavy. And in Mirena and Skyla, they become lighter. And the failure rate is 0.8, and in both two cases is 0.2%, Mirena and Skyla. Kylina, the newest IUD, was approved by FDA in September 2016 and became available in October 2016. It contains lower hormone level than Mirena. Based on these data, the CDC estimated the IUD-related fatality rate of 3 per million users per year of use, which is compared favorably to the mortality risk associated with pregnancy and other forms of contraception. Excuse me. IUDs and birth control. So what is an IUD? A small T-shaped bendable implant that's put inside the uterus. IUDs are either wrapped in the copper or contain hormones. Its benefit stays for 5 to 10 years. These are safe, long-acting, shorten your periods, and reduce menstrual cramps. Contraception. Putting an IUD is one of the most effective way to avoid pregnancy. They work in more than 99 out of 100 women. That means they protect against pregnancy 2 times more than pill, 10 times more condoms, and 30 times more with the method. Who can use it? Age 13 and up, who have had one or more partners, who have not had a recent pelvic infection, and concerns do not protect you from getting sexually transmitted infections, and who cannot have with a typical uterus, fibroids, or signs of pelvic inflammations. So IUDs can be used by many different women, even those with health conditions. Talk to your healthcare provider to find out if the method of contraception is right for you. Now moving towards the injectable contraceptives. There are types. One is progestin only. It includes a dapomedroxyprogesterone acetate. This is DMPA, 150 micrograms. It is microcrystalline suspension, which is used after 3 months, and norethistone enanthate, 200 micrograms in oil. It is used 2 monthly. Second is combined injectable contraceptive given on the monthly basis. It is MPA combined with estradiol, saponite, E2C, and the second one is Netten combined with estradiol valproate, E2V. These are the combined injectable contraceptive. So Depo-Provera medroxyprogesterone, it is acetate, it is 150 milligram per ml. It is progestin only. It inhibits ovulation for 3 months. IM injection in the arm or the glute region can be given for 5 days within the onset of menstrual bleeding, and it is repeated after every 12 weeks. It prevents the pregnancy from 14 weeks, but it is recommended to use it after every 12 weeks. Its advantages are highly effective, 99.7, increased compliance, amenorrhea, reduces risk of anemia, decreased menstrual cramps and pains, no drug interaction with anticonvulsant. Disadvantages: breakthrough bleeding, weight gain, headache, depression, decreased HDL, risk of ectopic pregnancy, contraception reversible in 4 to 13 months after discontinuation. So it is a graph and advantages of injectable contraceptive, progestin on injectables and combined injectables. Progestin on injectables are safe and highly effective, more than 99%, long acting but reversible, can be discontinued without provider's help, requires no effect on action at the time of intercourse, have no effect on lactation, and can be used by breastfeeding women. It is very important of its advantages of progestin on injectable that it can be used in lactating mothers, offer non-contraceptive health benefits. Then the combined have safe and efficacy more than 99%, reversible, can less menstrual disturbance, only progestin on injectable, and requires no action at the time of intercourse. So in the form of Depo formulation, we have injectables. We have discussed. The second is subdermal plants. These are non-plant 6 salicylic capsules, each containing 35 milligram of levonorgestrone. It is protection for 5 years. These are like needles like, and we just after giving a nick in the arm, small arm after giving local anesthesia, these capsules are implanted in the skin. These are called non-plants, prevents ovulation, more effective than the pill. Problems are difficulty in removing, side effects similar to pill, change in menstrual bleeding, headaches, and side effects are weight gain, acne, breast tenderness, hair growth, and ovarian cysts. Contraindications are liver diseases, breast cancer, cardiovascular disease, the unexplained vaginal bleeding, pregnancy, and smoking. So these are come in this sort of packing. You can see these are the 6 capsules, small needle-like, and these are placed in the arm. Moving towards the permanent methods. These are also called the terminal methods or permanent methods or one-time methods. The guidelines for these are: husband age must be around 25 to 50 years, wife's age 20 to 45 years, and they have should have 2 living children at the time of operation. Type of terminal methods are: for male, this is vasectomy and non-scalpel vasectomy, and for females, is tubectomy, mini lap operation, laparoscopic sterilization, and tubal ligation. Terminal methods. Sterilization is the only method which gives permanent protection from conception. Either husband or wife can undergo sterilization by simple surgical operation, which is called vasectomy or tubectomy. Vasectomy. It is a sterilization of males. It is very simple and minor operation, which takes hardly 15 to 20 minutes. The operation involves a small cut on both sides of subcroton where a small portion of vas difference about 1 centimeter on either side of skin is cut and lighted, folded back and sutured. The operation doesn't affect the sexual characteristics and sex life in any form. The sperms are produced, but they are not ejaculated in the womb. You can see like this. This being operated, cutted. Male sterilization complications include its inoperative procedure, sperm granuloma. It is this after the procedure, after vasectomy, it is a common complication because of the accumulation of the sperms in the body. It is some like sort of a swelling forms, which is called granuloma, but it's not cancerous and settles after some time. Then the spontaneous decanalization, and it has also a psychological impact. Post-operative advice is given non-sterile till 30 ejaculations. Avoid bathing till 24 hours of operation. These are the two important precautions which we have to say. One more, stop. The person is not supposed to carry heavy weights after this surgery. Then comes the tubectomy. You can see over here. It is a sterilization of females. It is done by the resecting a small part of fallopian tube and ligate the sealed eggs. The closing of the tubes can also be done by using other methods like closing the tubes with bands, clips, and electrocautery. The operation can be done through abdominal or vaginal approach. The most common abdominal procedure is laparoscopic or mini laparotomy. The tubectomy can be done after delivery, between delivery, and after abortion. So there's a permanent contraception. You can see I have told you you can use bands, cautery, clips, and this is the modified Pomeroy technique of female sterilization. In this, you just have to pick it up, fallopian tube, hold it, make a clamp, and then it is being cut it. It is just like that. Recent advances. According to CDC, what there was article on the reproductive health on the contraception, and they have in this article they have mentioned that all the methods like barrier methods, hormonal methods, reversible methods for birth control, emergency contraception, permanent methods of birth control, male and female sterilization. They have just given the description of all these methods which we have covered in this presentation and previous two presentations. Then the one of the second article of CDC ensuring assessing to family planning services during COVID-19. It was a summary of CDC family planning recommendations for healthcare providers, which includes to continue to assess needs for family planning services through telemedicine and pharmacist prescribed contraception for new contraceptive users or those wishing to switch to a new method. Most contraceptive methods are safe and needs no lab test and physical examination, and all the methods can be started on the day of request unless patient is not pregnant. Immediate post-pregnancy contraception can be used like IUCDs and implants. For current contraceptive users who want to initiate a new method or continue with their current method later, no ongoing follow-up is needed. So then the Pakistan commitment maker since 2012, it was the since first making a commitment to family planning 2020 in 2012, Pakistan has demonstrated ongoing effort towards the promotion of family planning. As of this year, all 4 provinces have drafted, costed, implemented plans for family planning and developed family planning task forces comprised of public and private sector stakeholders. To continue promoting strong government commitment, Pakistan will work to strengthen collaboration among regions under a developed system in order to reach 6.7 million additional user increase contraceptive prevalence rate to 50% by 2020. So these are the figures. Core indicator summary sheet 2019-20 annual progress report. It is shown each indicator, the number of additional users of moderate methods of contraception. In 2012, there was 0. And by increasing in 2020, there were 2,03,000, 32,000, and like this. Then the contraceptive prevalence in modern methods in 2012 it is 16%, and 2020 till now 17.6%. Then the percent of women with unmet needs of modern methods of contraception, and these are different indicators, number of unintended pregnancies and everything. It is given in this record. Then UNFPA, Pakistan brief on COVID-19, impact of COVID-19 on reproductive health, family planning, and gender-based violence in Pakistan. It was published in May 2020. Yeah, this is United Nations funding for population affairs. So it is in this, it was mentioned at a glance, family planning in Pakistan, 8 million women use modern contraceptives like condom use is maximum, like 30,000. And the 5.5 million women are with the unmet needs of contraception. 3.5 million unintended pregnancies occur each year, and 2.6 million induced abortion take place every year. In next 3 months, 10% decline in use of modern contraceptive will result in additional women will be with unmet needs of modern contraception, 12 lakh, then 5 lakh additional unintended pregnancies will occur, and additional unsafe abortion will happen. And if this decline is 20%, the use of modern pills, modern methods, then there will be additional women with unmet needs. Like you can see the difference in the figure, it's 5 lakh, is 9 lakh 24,000, and 2 lakh additional unsafe abortion, then there will be around 4 lakh additional unsafe abortions will happen. Now, the barriers to family planning in Pakistan. In this article, according to last census conducted in Pakistan 2017, Pakistan population was 207.7 million, growth rate was 2.4 currently. Researchers and policymakers estimated that if the growth rate of Pakistan remains the same, then by 2050, Pakistan will become 5th most populous country in the world. Pakistan has a commitment of family planning 2020 that Pakistan will achieve a CPR rate of 55% at the national level, but it seems difficult to achieve as Pakistani Demographic Health Survey conducted during 2017-18 show that overall contraceptive prevalence rate of Pakistan is 34%. In this review, we have identified barriers that can restrict the use of family planning, which includes lack of knowledge and motivation, lack of agencies, communication gap, and limited availability and accessibility. There is a need to increase awareness and understanding of contraceptive methods, change negative attitude, and help couples to change their behavior. The decision makers should make policies that can help in improving family planning usage and help in population control. Now moving towards the multiple choice questions. Number 1, a woman 35 years of age, smoker, para to abortion, one wants to use contraceptive pills for birth spacing. Lady doctor advise her not to use contraceptive pills because these are mostly associated with the increased risk of cervical cancer, bronchitis, breast cancer, coronary heart disease, and peripheral neuropathy. No, it's coronary heart disease. D. 30 years old female para, one suffering from pelvic inflammatory disease, comes to family planning clinic and wants to seek advice from doctor regarding contraception. Which of the following contraceptive method is contraindicated in this patient? Injectables, hormones, oral contraceptive pills, condoms, Norpal, intrauterine device.
Intrauterine device.
Yes. Yes, E is the answer because she has pelvic inflammatory disease. A 35 years old female has come to family planning clinic for advice on contraception. While taking history, she was hypertensive and gave a past history of deep vein thrombosis. She had 5 children, 2 boys and 3 girls. The following method of contraception is not appropriate for her. Calendar method.
D.
Or oral contraceptive pill.
Yes. A newly married educated couple wants to delay pregnancy for 2 years. The couple comes to a family planning clinic for advice on contraception. The following method is the most appropriate method. Condoms or combined oral contraceptive pills?
A.
Yes, A is the correct. A. A 45 years old mother of 5 children had recent abortion. He had also become hypertensive and diabetic. She seeks advice about methods of prevention of pregnancy. The most suitable method for her is
IUCD. A. Tubal ligation.
Yes, yes, not tubal ligation because she is 45 years old, 5 children. So the most appropriate choice at this age is tubal ligation for her. A 27 years old female delivered her first baby with cesarean section. She needs to be counseled about adoption of an appropriate method of contraception for birth spacing. The most suitable method for her is?
C. Injectable hormones.
Sorry? A. A is the correct answer. IUCD is the most appropriate method. A 28 years old female para to abortion zero who is breastfeeding her 8 months old baby and wants a birth spacing for at least 3 years. Which method of contraception is most suitable for her? Progesterone pills, combined pills, injectable hormones, condoms, or tubal ligation?
Delta.
C.
C, injectable hormones, because it is safe in the breastfeeding. A 38 years old female, Gravida 6, para 4 with a history of recurrent chlamydial infections, PAD, wants advice regarding contraceptive used to prevent further pain. She should not be given the choice of Norplants, oral contraceptives, IUDs, terminal methods, and injectables.
C.
Yes, correct. IUCDs. A 30 years old woman with 2 children required temporary method of contraception. Her husband refused to use any method. She gives history of irregular menstrual cycle, and on investigation, she was anemic and had uterofibroadenoma. The contraceptive method most suitable for this woman would be condom, IUCDs.
C. Implant.
C.
Yeah, the combined oral contraceptive pills.
C.
Combined oral contraceptive pills. A male came to family planning clinic for vasectomy. After completion of procedure, he was told that he was not sterile immediately. He must use some other method of contraception.
B.
B. 30 ejaculation.
30 ejaculations, yes. This is key, and thank you so much.
Thank you very much, Dr. Sadia. Very well done and very good presentation, especially your MCQ part. That is all are applicable, and these are the real scenarios that are being presented in our practice, as well as in for the postgraduate students understanding how the side effects and different contraindications and the socio-cultural events they correlate while there was any decision about contraception has to be made. The most important MCQ that I want to highlight here was MCQ number 8. It is one of a very important MCQ that you have presented, and a problem, a real life problem. Another thing that you have presented is about recent advances. The first slide about the recent advances, if you please go to that slide, I want to know what is the recent advances that has been presented in that slide.
Madam, this one? Madam, this
Yes.
one, yes, ma'am, in this, actually, I didn't go into the details of this actually slide. These were all the methods which we covered in last two presentations by Dr. Ambar and Dr. Meha. Basically, they have covered all these things I've just mentioned because they have again stressed, CDC again stressed on the barrier methods, condom, diaphragm, sponges use, hormonal methods like pills, injectables, depot, and then Norplants, then the reversible methods by IUCDs, then the emergency contraception and permanent methods of male and female sterilization. I just mentioned the name, and again, in this, they have just emphasized on the use of this, all these methods. I give the elaboration of all these methods. That's why I placed this slide in it.
Right. The recent advances means that there is something that is being done in present, or there are some implications for future, so that our knowledge is updated about the things that are being practiced today and how they would be changed in the future. So what was the recent advance that has been made in this aspect?
Ma'am, yeah, basically, it was basically emphasized because in our culture, contraception is usually being practiced by the married couple. This article has a stress on the teenage use, and above that, with single with multiple partners. They have basically advised them to use different contraceptions in all these scenarios.
Okay, I think I am not still very much clear of what is what is the recent advance in it. However, if you please have some recent advance in it, please make a slide just next to it and put the recent advances that has been mentioned in that article, right? Because all these things that are already known or that are already being practiced or implemented, it is actually not the recent advance.